In patients with ACL injuries, one area we pay close attention to is the back of the meniscus. I'm Dr. Sean Leo, your friendly orthopedic surgeon. A RAM tear occurs where the meniscus attaches to the joint capsule at the back of the knee. This area plays a subtle but important role in stabilizing rotational movements. Because of its position, it's not always obvious and can sometimes be overlooked, but functionally, it matters. When this part is injured, patients may continue to feel instability or discomfort, even if the main ACL issue has been addressed. This is why some recoveries feel incomplete, not because progress isn't happening, but because part of the picture hasn't been fully accounted for. If your knee still feels off, especially during turning or loaded movement, that's worth paying attention to. For now, keep movement controlled and avoid pushing into positions that feel unstable. Even small, consistent movement helps rebuild control. And if something doesn't feel right, getting a more detailed assessment often helps connect the dots.